this module, we will be talking about brief interventions and motivational interviewing for physical activity promotion. At the end of this session, you will be able to describe primary healthcare workers' role in promoting physical activity, discuss how to challenge myths about the physical activity, explain behavior change models, explain brief interventions in terms of promoting physical activity, and also to discuss application of brief intervention models in promoting physical activity. What is the role of a primary healthcare physician in promoting physical activity? Simply, the prime role is to promote the community to move more. Let's look at the role of a primary healthcare worker in promoting physical activity. Basically, he or she should promote physical activity among the population, educate the clients on benefits of physical activity and health risks associated with physical inactivity at every consultation, assist clients to make plans for physical activity, prepare the action plan related to physical activity promotion for his or her area, should identify relevant settings, required resources, and infrastructure that required for physical activity programs within the community. Also, he or she should make plans to monitor and evaluate the progress of physical activity. This activity focuses on challenging myths about physical activity that we will face from the community. Various myths on physical activity can act as barriers to promote the physical activity. Being aware of these myths will help you to overcome these barriers. Some people have the belief that little bit of exercise is not enough. It should always be at least 30 minutes at a stretch. Some believe that weight reduction is not required, so they don't need to be physically active. Some people think engaging in physical activities is too expensive. It needs special equipment, including special shoes and clothes. And some think that it is mandatory to use sports facilities to engage in exercises. With regard to children, they think that children by nature have so much of energy and they hardly stay still. So there is no need to spend time or energy teaching them about physical activities. They think children are already so active. Some people tend to believe it's too late to start to be physically active. Most importantly, community believe that women need to do strengthening exercises. They also believe that continuous exercising for 30 minutes is a must, or you need a particular place like a ground, track, or gym to do exercises. Other myth is that they think daily activities like household chores are enough. No need to do exercises separately. If you are lean, it is a common belief in the community that you are fit and need not to do exercises. Other common belief is if you exercise, you don't need to control the diet. They think you need to eat more when you do exercises. When addressing these myths, it is mandatory to emphasize the benefits of physical activities to the patient. It is also important to make sure the client understand the difference between myths and the fact, and you need to help them to overcome these myths with logical reasoning. In order to be physically active, we have to change the mindset or the attitude of the community. We have to approach them by using the stages of behavior change to analyze in which stage the client is at present. There are 5 stages of behavior change cycle. The first stage is pre-contemplation. In this stage, they are not aware of the problem and not intending to start any change to the existing behavior. The second stage is contemplation. In this stage, they are aware of the issue. They think seriously that they need to change, but still no action has been taken to change the existing behavior. The third stage is preparation phase. Here, they take small steps to change the behavior. Action phase is the fourth stage. In this stage, active behavioral changes had been done by the client to adopt to the new behavior. In the last stage, which is the maintenance phase, the client maintains the new behavior. Let's learn the principles and techniques of motivational interviewing. They are: you should not tell the person to what to do. Listen the client and show empathy. Help the client to understand the gap between where they are now and where they want to be. Let the client himself to come up with the idea that he or she need to change the existing behavior. Help the client to feel confident about changing. Always roll with the resistance. Let's look at what a brief intervention is. It's a short intervention of 3 to 20 minutes which aims to identify the problem and provide information about it. In this intervention, you should motivate and assist the client to take the decision as to what, when, and how to do. Now we will discuss about brief interventions using the 5 A's and 5 R's model. The 5 A's brief intervention model help people who are ready to change their behavior, while the 5 R's brief intervention model motivate the people who are not yet ready to change their behavior. Let's look at the 5 A's brief intervention model in detail. 5A stands for ask, advise, assess, assist, and arrange. This summarizes what a healthcare worker can do to help someone who is ready to change. Ask. The healthcare worker will ask the most important aspects of behavioral risk factors from the client. Advise. The healthcare worker would provide the minimum key messages to all clients. Assess. Healthcare worker find out whether the client is ready for additional information and assistance. Assist. Provides more in-depth counseling and assistance. Arrange. Provide referrals and follow-up actions. This slide discusses more about 5 R's brief intervention model. 5R stands for relevance, risk, rewards, roadblocks, and repetition. These are areas that should be addressed in a brief intervention to help people who are not ready to change at this time. These are areas that should be addressed in a brief intervention to help people who are not ready to change at this time. These people are in the pre-contemplation or contemplation stages of the behavior change. If the person does not want to change or does not think that the change is important, focus on the risk and rewards. Try to identify roadblocks and address them appropriately. This slide summarizes the process of utilizing 5 A's and 5 R's brief intervention models for behavioral change of a client. When using the 5A model, if it is evident at the assess stage that the client is not ready to change, the 5R technique can be used at that point. However, even after using the 5R technique, if the client is still not ready to change, it is best to end the brief intervention on a positive note. In this activity, the objective is to make participants understand that clients can be different stages of behavior change related to physical activity. And also, this will show how we can utilize the 5 A's and 5 R's brief interventions to promote physical activity among the population. This can be done as a role play in your setting when you are providing the training where participants can take turns of healthcare workers and clients separately. First, the participant who is going to take the role of the healthcare worker can assess the level of physical activity of the client. Then, advise the client by providing clear and personalized messages. Next step will be to assess the readiness to change. Finally, it will be to assist and arrange practical counseling on physical activity. After this session, the other participant can share the good practices in the role play and provide suggestions to improve the assist and arrange session. Then you can arrange another role play providing 5 hours briefing to increase the motivation. This time, if the client does not show the readiness to change, then the healthcare worker in the role play can use 5 hours framework to enhance the motivation of the client. After this session, you can take suggestions from other participants. List suggestions for improvements in the 5-hour session to successfully motivate the client. What are the existing initiatives in the community for our participants to improve their physical activities? Think about the setting in your community. Now, at the end of this model, you can come up with a plan to propose innovative initiatives to promote physical activity in your community. When you start an activity in your community, always have a plan on how to get the maximum participation and support from the community to make the program a success. These are the references that used to prepare this module.